Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the hypothyroidism, their definition and the epidemiology. Hypothyroidism is traditionally defined as the deficient thyroid production of thyroid hormone. Prevalence of the overt hypothyroidism varies from 0.1 to 2%. Hypothyroidism is the 5 to 8 times more common in the woman than men. There are the hypothalamus, their anterior pituitary, and their formation of the TSH, and thyroid gland is there are the little active T3 T4 secretion, lack of the iodine due to lack of the negative feedback inhibition, increase the tropic hormone secretion, and high TSH causes the goiter. So hypothyroidism is the 5 to 8 times more common in women to men, primary autoimmune disease, secondary tumor, and the peripheral. First is the primary autoimmune disease, iodine deficiency most common worldwide, surgery, radiation therapy, medication, lithium, tyrosine kinase inhibitor. Second is the tumor, pituitary adenoma, carcinoma, meningitis, trauma, surgery, radiation, head injury, infections. Next is the infiltrative histiocytosis, chronic lymphocytic, and drug are the dopamine and the glucocorticosteroids. Next are the peripheral consumptive hypothyroidism, massive infantile, and the mutations in gene encoding for MCT8, SECIS, BP2, TR alpha or TR beta, thyroid hormone resistance. There are the diagnoses of the primary hypothyroidism. Primary hypothyroidism indicates the decreased thyroidal secretion of the thyroid hormone by factors affecting thyroid gland itself. Fall in serum concentrations of thyroid hormone causes an increased secretion of TSH, resulting in elevated serum TSH concentration characterized by the high TSH and low free T4. Thyroid peroxidase TPO antibodies are elevated in majority of patients with chronic autoimmune thyroiditis. Next is the manifestation of hypothyroidism. Common symptoms are the fatigue, cold intolerance, weight gain, constipation, dry skin, myalgia, and menstrual irregularities. Physical examination are the goiter, bradycardia, diastolic hypertension, and a delayed relaxation phase of deep tendon reflexes. Metabolic abnormalities are the hypercholesteremia and the macrocytic anemia, elevated creatinine kinase, hyponatremia. In today's class, I discuss about the following definition and epidemiology of the hypothyroidism. Thank you for watching.